Welcome back to another episode of HealthCap Weekly Wrap. We've got a packed show today with some really important updates for senior living communities.
Yeah, there's a lot happening right now. New Alzheimer's diagnosis guidelines, HIPAA regulation changes, and some key compliance updates that providers need to know about.
Right, and we're also diving into CMS's latest push to prevent unnecessary medications and the misuse of chemical restraints. There's a lot of movement in this space, and it's critical for providers to stay ahead of these changes.
Absolutely, whether it's infection control, pain management, or resident rights, we've got all the details on what's changing and how it impacts day-to-day care.
So let's jump right in. First up, we're talking about the new Alzheimer's diagnostic guidelines, what's changing and what it means for residents, families, and caregivers.
Alzheimer's disease is one of the biggest challenges in senior care, and now there are new guidelines that could change how we diagnose it.
Yeah, the Alzheimer's Association recently updated its clinical practice guidelines for the first time in over a decade. The goal is to give a more structured approach to identifying the disease earlier and more accurately.
And that's a big deal because early detection means better care planning, more support for families, and potentially slowing progression with available treatments.
Exactly. The new guidelines break down the diagnostic journey into clear steps, starting with recognizing early symptoms, then using cognitive tests, biomarkers, and imaging to confirm a diagnosis.
Biomarkers are an interesting piece of this. These are measurable biological indicators, things like amyloid plaques or tau proteins that show up in the brain. The guidelines emphasize that while they're helpful, they shouldn't be the only factor in diagnosing Alzheimer's.
Right? And there's also a push to use more comprehensive cognitive testing rather than relying just on quick memory screenings. The idea is to get a more accurate picture of someone's cognitive health.
So what does this mean for senior living communities?
It means that providers need to stay informed about these updated guidelines, work closely with physicians, and help families navigate the diagnosis process. If a resident is showing signs of cognitive decline, knowing these new steps can help guide families toward the right resources.
And ultimately, this can lead to better care plans, more personalized support, and improved quality of life for residents.
All right, let's keep it moving. Next up, we're talking about HIPAA. There are some new regulations on the horizon, and providers need to be ready.
HIPAA regulations are getting an update, and that means providers in senior living communities need to pay attention.
Yeah, these changes are meant to strengthen patient privacy rights, improve data sharing, and clarify some long-standing compliance gray areas.
One of the biggest shifts is around information sharing. The updates aim to make it easier for healthcare providers to share information with family caregivers while still protecting resident privacy.
That's huge for senior living because families are such a critical part of a resident's care. The current rules can sometimes make it tough for providers to communicate with families without running into privacy concerns.
Exactly. The new regulations would give more flexibility, especially in situations where a resident might not be able to give explicit consent, but clearly benefits from their family being involved.
There's also a stronger focus on cybersecurity. With ransomware attacks and data breaches on the rise, providers need to step up their game when it comes to protecting electronic health records.
Right, and that means making sure staff are trained on things like phishing scams, using strong passwords, and properly handling resident data. These new rules could also lead to higher penalties for noncompliance, so it's not something to take lightly.
So what should senior living communities be doing now?
First, stay informed. These changes aren't in full effect yet, but they're coming. Second, review your policies, especially around how resident information is shared with families. And third, make sure cybersecurity training is part of your compliance plan.
And if you're looking for more guidance, HealthCap has some great resources, including webinars on HIPAA compliance and cybersecurity best practices. These are really helpful for staying ahead of the changes and making sure your team is prepared. Check them out on our Resource and Education Center at riskmanagement.healthcapusa.com.
It's all about balancing privacy with practical care. When done right, these updates could actually make it easier to support residents and their families while keeping their data secure.
All right, up next, we're diving into a big topic: regulatory compliance and best practices in senior living. We'll cover pain management, infection control, and what providers need to know about resident rights.
Regulatory compliance is always a big topic in senior living, and there are a lot of important updates providers need to keep in mind.
Yeah, from pain management to infection control, professional standards, and even resident transfer and discharge rights, several F-tags have been revised, and providers need to make sure they're up to date.
These updates come from the American Healthcare Association and National Center for Assisted Living, which provides detailed guidance on F-tags and regulatory best practices. But keep in mind, you do need to be a member to access the full documents.
Let's start with pain management. F-tag 697 has been updated to emphasize a stronger focus on individualized pain assessments. Surveyors will now look more closely at whether providers are using comprehensive resident-specific pain evaluation tools rather than relying solely on routine medication use.
That's a big shift, because it means communities need to show they've explored multiple approaches to pain management. Not just medications, but also non-pharmacological interventions like therapy and lifestyle modifications.
Speaking of medications, infection prevention has also seen updates. F-tag 880 now requires communities to document more detailed infection tracking and staff training efforts. Facilities are expected to show clear evidence of infection control policies, and surveyors will be checking whether staff members are consistently following hand hygiene and PPE protocols.
Right, and it's not just about policies on paper. Surveyors will be interviewing staff to make sure they actually understand and follow these protocols.
Now, when it comes to professional standards, F-tag 658 has been expanded to clarify the accountability of licensed professionals. The updated language stresses that all care must align with current professional standards, and communities need to prove that they're keeping up with best practices in resident care.
And that ties into the role of the medical director. F-tag 841 has been revised to increase the oversight expectations for medical directors. The updated regulations require more involvement in quality assurance and infection prevention efforts. Basically, CMS wants to see that medical directors aren't just advisors, but are actively engaged in the clinical operations of a community.
Then there's the issue of resident rights, especially when it comes to transfers and discharges. F-tags 627 and 628 now include stricter documentation requirements when a resident is being transferred or discharged. Providers will need to show clear justification for any move and provide better communication to residents and families about their options.
And that's an important change because there have been concerns about involuntary discharges. These updates are meant to make sure residents' rights are protected and that families are fully informed before any decisions are made.
Yeah, these aren't just guidelines, they're federal regulations. If a community isn't following them, they could be at risk of citations, fines, or even more serious consequences.
That's right, so make sure staff are trained on these changes. Compliance isn't just about leadership. Every team member plays a role. Also, conduct regular audits to identify any gaps before a surveyor does.
And that brings us to another critical regulation, F-tag 605, which covers a resident's right to be free from chemical restraints.
Yeah, the updated guidance makes it clear that psychotropic medications should not be used unless they're medically necessary, and only after other interventions have been considered. Surveyors will be looking at whether providers have documented attempts to use non-drug approaches before prescribing these medications.
It's a big shift in accountability. Communities will need to show they've assessed behavior triggers, tried non-medication strategies first, and monitored the effects of any psychotropic medications that are prescribed.
And PharMerica recently issued a compliance cue on this same F-tag, reinforcing the importance of avoiding chemical restraints and ensuring psychotropic medications are used appropriately. Their guidance outlines what surveyors will be looking for and how communities can stay compliant. Let's take a closer look at what's in that guidance and what providers need to be prepared for.
Right. PharMerica's compliance cue on F-tag 605 makes it clear that surveyors are taking a much closer look at how psychotropic medications are being used in senior living communities, reinforcing the importance of avoiding chemical restraints and ensuring psychotropic medications are only used when medically necessary.
Yeah, and now CMS is taking this a step further with new surveyor guidance on preventing unnecessary medications. This updated guidance goes into effect on March 24th, 2025, and it's designed to give surveyors clearer expectations on what to look for during inspections.
The biggest change is that surveyors will be asking more detailed questions. They won't just be reviewing medication lists. They'll want to see proof that non-drug interventions were attempted first, that medications are being reassessed regularly, and that there's a valid medical need for every prescription.
Right, and documentation is key. If a resident is on a psychotropic medication, there should be clear records showing why it was prescribed, what behaviors or symptoms justified it, and how it's being monitored.
Another focus area is duplicate therapy and excessive dosing. If a resident is on multiple medications for the same condition, providers will need to justify why each one is necessary and show that the medications aren't causing unnecessary sedation or side effects.
And just like we mentioned earlier, gradual dose reduction plans are going to be a major focus. If a resident is on a psychotropic medication, there should be a documented plan to reassess the dosage and, if possible, reduce it over time.
So, what can providers do now to prepare?
First, make sure all staff, especially nursing teams, understand this new guidance before it goes into effect. If surveyors are asking more questions, staff need to be confident in their answers. Second, audit documentation now. If a resident is on a psychotropic medication, their records should clearly show why it was prescribed, what non-drug interventions were considered, and how its effectiveness is being monitored. And third, work closely with pharmacists. Regular medication reviews can help identify opportunities to adjust dosages or discontinue medications that may no longer be necessary.
At the end of the day, this isn't just about compliance. It's about making sure residents are getting the right care without unnecessary medications.
Okay, that wraps up this week's updates. Thanks for joining us, and as always, you can find more details about these stories in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
Take care, and we'll catch up next week.